This is Pet Life Radio. Let's talk pets.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
My clients usually gnash their teeth when I tell them that their pet needs dental care, often with multiple extractions. But why, they ask? The groomer brushes their pet's teeth every 6 weeks. They give them the dental chews that the pet store recommends, and they had their teeth cleaned 2 years ago. What gives? Dr. Eric Van Nuys is a board-certified veterinary dentist in Tustin, California. He'll give us some great tips to chew on for home pet dental care. We'll be right back after the short break.
Molly, here's your dinner. Zeus, that's not your food.
Don't let that happen to your precious cat. Elevate your cat's eating experience with the Cat Tree Tray. The Cat Tree Tray keeps your cat's food off the floor and conveniently located on the cat tree. It's the perfect way to eat. It's a beautiful wrought iron tray that easily attaches to your cat tree and keeps dogs and other critters out of your cat's dish. A must for multi-pet households. There's a 6-inch tray for large bowls and a 4-inch tray for smaller bowls. Purchase your Cat Tree Tray today. Go right now to cattreetray.com. That's cattreetray.com. CATTREETRAY.com.
Let's talk pets on PetLifeRadio.com.
Dr. Van Nuys, thank you so much. I had the opportunity to visit at your clinic a couple of weeks ago, and you gave a really excellent presentation to all these veterinarians that were there. And I thought this would be perfect because you were talking about dental chews and dental care. So thank you for being with us today.
Well, we were glad to see you, Dr. Cruz. We had a good day that day talking about how our patients break their teeth particularly.
And they're so good at that. Well, before we get into how they break their teeth, there's a lot of myths and misconceptions that pet owners, I think, have, and you hear them all the time, and so do I. And number one of the things I hear, especially from clients who are a little on the mature side, they go, I've owned pets for years. I've never had their teeth cleaned. I gave them bones to chew on, and their teeth were fine, and you veterinarians are just trying to make money. Why is it that things have really changed so much? Because I know when I was in veterinary school, I didn't learn a lot about veterinary dental care.
Well, isn't that true? I'm a 1986 grad. It doesn't seem like that was all that long ago, but we learned very little about dentistry in veterinary school. I think you probably had pets when you were young. We all did, and I don't think that most of us did brush their teeth or take them to the veterinarian or really notice that there was a problem in their mouth. But I think the most likely explanation is that there certainly was disease in their mouth, but it's hidden disease, and our pets are not good at telling us about it.
I'm amazed sometimes, and I'm sure you hear it too, that a pet comes in and you're looking at this mouth and, oh my goodness, how they ever got close to it, kissed it, etc., and their teeth are being held on by a wisp and a prayer and the junk that's on their teeth. Why don't they tell us that their teeth hurt?
I don't think they have the ability to tell us that their teeth hurt. It's amazing to me, too, that you would think looking in that mouth and smelling the room that they would be terribly painful and they would have reduced function. They wouldn't be able to eat or chew. But honestly, they have to be in terribly, terribly bad shape before they display any symptoms at all to the pet owners.
When I'm showing a client teeth and I'm going, okay, this is plaque and tartar. You and I listen to commercials on TV about toothpaste that we can use and it brightens our teeth and it keeps the plaque under control. what's the difference between plaque and tartar, and how quickly does it build up in a pet's mouth or our mouths?
Yeah, isn't that something? The plaque is the kind of slime layer, if you will, that builds up on the surface of the teeth and the gums. It's from residual food, and it's from the lining of the mouth and the tongue, and it builds up, honestly, in about 3 hours. If you have the best cleaning in the world and you brush your teeth, 3 hours later, plaque comes back. And so what happens is if the plaque sits there for about 3 days, it accumulates the minerals from the mouth and the saliva, and it hardens into like a coral reef. That's the tartar that sticks to the tooth surface, and it's that brown color. Once the tartar has stuck to the surface of the tooth, we can no longer brush that off. It has to be scraped off with an instrument, cleaned at the dentist. So that's the reason that we want people to brush every day, because if you miss 3 or 4 days, it's not reversible anymore. So you got to brush every day.
So going in every 6 weeks when they get their haircut at the groomers, having their teeth brushed, it sounds as though those groomers aren't really giving them maybe the best education and care that they can, because I think for a lot of these pet owners, they have a false sense of security that, I'm getting my pet's teeth brushed, so it must be just fine.
I'd agree with that. I don't really blame the groomers so much for doing the best they can with the patient they have on their grooming table that day. The best they can is to clean that pet up the best they can that day. But it would be nice if they would tell folks that that's not going to stop the disease for the next few months, that they do need to keep up with brushing every day.
So I know when my granddaughter was born that her pediatrician recommended as soon as those baby teeth come in, start brushing. It's like, they're little baby teeth. Why are you brushing these teeth? And it's like, all right, you could understand it's, number one, getting them used to it, but for longevity, it was going to be better for those baby teeth and the adult. How about our pets? When should you start brushing their teeth?
Yes, as soon as those baby teeth come in, you want to brush, and it's exactly for those same 2 reasons. You want to keep those baby teeth healthy so that the gums are healthy and the adult teeth that come on later are going to be healthy. And you also want to get that pet used to the good habit of brushing their teeth every day. And we don't want people to just run right up to the pet the first day and start scrubbing away. That's a good way to teach the pet that it's not a nice thing. But like any other behavior that you want to introduce and promote, you can ease into it step by step. So at our house, for instance, in the evenings when it's our time to brush our teeth, the family in the bathroom, we tell the dog something silly like, doggies brush teeth, kind of like we tell them doggies go potty when we want them to go out on the fake dog grass and go where they're supposed to go. So we tell them doggies brush teeth, and they hear that repetitive phrase, and they've learned over the years that this is fun, social time. They're going to get some attention from us, and they're going to get a little TLC. And if we just start easy by letting them taste the toothpaste, and then a few days later let them taste the toothbrush, and then a few days later we've got the brush in their mouth, by the time a few weeks go by, they've got the good habit that brushing teeth is fun, and they can keep that habit going that way.
It's great. So it gets the human in the habit. Every night you're brushing your teeth. All right, grab up the pet and start brushing. We're talking about dogs, but you can also do a cat's teeth, correct? You should do a cat's teeth.
Yes, you certainly can. There's a lot less to do. It might be a little harder to get to, and I think some cats may be less cooperative than some dogs. But
no, it's a cat.
It certainly could be done.
So if you have a Labrador, you have a good-sized mouth to get a toothbrush in. But what happens when you have that little teacup chihuahua in that itty-bitty little mouth? What do you recommend using? Because I know one of the things I'll sometimes recommend is using a Q-tip. It's not as abrasive as a toothbrush, but sometimes for me it seems to be easier for the pet owner to get in there.
Yes, sometimes as veterinarians and as pet owners, we have to improvise, don't we? We had a 220-pound patient on our table a couple of weeks ago, and a couple of days ago we had one that was under 2 pounds. So
oh my goodness,
have to be flexible and invent whatever works. So yes, a Q-tip is another good alternative. There are little finger puppet sort of brushes that you see at the pet stores. Some people will wrap a gauze around their finger, and nothing's as good as a toothbrush. So if you can find a teeny tiny baby toothbrush that's nice and soft, that's going to be the best option. But I fully understand sometimes we have to come up with other solutions too.
How about when you have that older pet? Many times people are now rescuing the adult cat or dog, and we're looking at their mouth going, it looks pretty good now, but I think you should start brushing their teeth. And they give you this look of, are you kidding? It's too old for this. How about that? What do you talk about the older pet?
Those people are heroes, aren't they, that take a pet that hasn't worked out somewhere else, and it's no longer a cute puppy or a kitten, but they're going to do the best they can for that pet for as long as it has to go. So we admire those folks. They certainly, most of the time, they've got to play a little catch-up. Brushing is more of a maintenance situation where there is no active disease and you're just trying to prevent the plaque from turning to tartar, from turning to inflammatory disease. And in those older patients, usually there is hidden disease that needs to be looked for, discovered, brought to the client's attention, and then dealt with. And then once maybe they have a pocket that needs to be cleaned, or maybe they have a rotten tooth way in back, and that's where the stink is coming from. And once you get that all cleaned out well, then they can get back to their good habits of maintenance brushing.
And you're talking about those teeth in the back. So many times, client comes in, and I'll mention something about teeth, and the breath somewhat stinks, and you smell it across the room. And they go, they lift up the front portion of the lips and go, look, these teeth look good. And you look at those little baby teeth in front, the incisors, or even the canine teeth, and they look pretty decent. But then you pull that lip back towards the ear, and you look at those teeth in the back, the molars and those large premolars, like, oh, that's where that smell is coming from. Why do they tend to build up so much tartar back there?
It's amazing how many pets' teeth, too. The dogs have 42 teeth and cats have 30. Compared to people, most of us are walking around with 28 or so. Their muzzles are long, so the teeth go way, way back. The teeny tiny teeth way in the back have little short roots. They often have multiple roots that are either touching one another, and they're not very long, and there's not a lot of bone back there, so they're at a little disadvantage. They don't have a lot of bone support to begin with. Then even the best intentioned person who wants to brush back there is going to have difficulty finding those teeth and getting some contact with them, just because they're far back there and the mouth doesn't open real well and the lips are kind of closed. So that combination just leads, it seems like periodontal disease is worse back there in the front in many cases. The other thing that's going on there is that's where the saliva comes out, and the saliva is where all the minerals are, and the minerals in the saliva bathe the teeth back there, and that's where tartar comes from. So it's kind of a combination of problems that lead to those back teeth being a hidden problem that stinks.
And you mentioned periodontal disease, and I think that's a word that many of my listeners may not be familiar with. What is periodontal disease?
Yeah, so it's gum disease gone worse. We talk about gingivitis being an inflammation of the gums, where your gums are red and bleeding. Periodontitis is the next step, where the gum disease has turned into bone disease, meaning that the bony tooth sockets that are supporting each root starting to melt away due to the chronic infection and inflammation. So gingivitis is an earlier stage. Periodontitis is a later stage where the bone is a problem, and that's where loose teeth come from.
Is there anything, I know that we'll get in there really clean. There's even antibiotic gel that you can put under the gum line. But as I understand, once you've lost that connection of the tooth to the bone, you can't get it back again. Am I correct on that one?
I think you're right. Gingivitis, the pure inflammation of the gums, is considered to be reversible by cleaning really well and then getting in the good habit of brushing. Reversible because your gums are that soft tissue with a good blood supply, and they'll heal. Once the bone has melted away, trying to get that bone back, it takes real heroic surgery and repeated recalls under anesthesia, repeated procedures, probably every 3 months. Kind of like people who go to their periodontist for a deep scaling every 3 months. And then, even then, most of the time that regaining the bone is minimal. You're kind of in a long-term hopeless situation. So yes, that's why we want to focus our efforts on the reversible stage, where the bone has not yet melted away and we're just dealing with the gums.
Well, you said that brushing is the gold standard, and it's something that people really need to get into the habit. And some of us are busy, and you have other things you're doing, or your pet's not really cooperative. You go to the pet store, you look in some of the dog and cat magazines, and there's all these various products. And boy, I'd love to have your take on that. Some of them seem to be these liquids, and you see the before and after. You put this liquid in the water, and these teeth that were just horrible, that had all this calculus on it, this tartar, the hard concrete on those teeth, the coral, as you said. And then, gee, magically, it's all gone. What are your take on some of these different dental products? Do they really work like that?
There are some that are helpful, but there's none that are that helpful or that dramatic that is going to take the plaque and the calculus, the tartar off of the teeth. There are chemicals that will do that, but you really don't want to put them in your mouth. It would be acids mostly. So the gels and the liquids that are somewhat help are more preventative help where they can reduce the accumulation of plaque. And there are drops you can put in the water that help a little bit. There are gels that you can kind of squirt in the mouth and let the pet rub it around. There are sprays that you can spray in the mouth and they kind of smack their lips. But, it's the same as when I go to my dentist. If my dentist tells me to brush my teeth every day, my dentist does not tell me to put magic drops in the water or to buy a bag of Chewies. It really does come back to brushing is the gold standard. Everything else is just a little bit of help.
All right, so we'll get onto those products right after this short break. So I'm having the pleasure of speaking to Dr. Eric Van Nuys, a board-certified veterinary dentist in Tustin, California. We'll be right back, so go brush your teeth, get your pet ready to have its teeth brushed. We'll be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
You think that you're rescuing them, but honestly, they're going to end up rescuing you. You don't know what they've gone through, and they're not going to be perfect. And they are so happy that you are taking a chance on them to be a part of your family. I urge you to go down to your local shelters, pounds, dog rescues, foundations, you name it, and rescue a dog. Once you get your rescue dog, you should definitely order some Dinovite. Go online and order it. DINOVITE.com. Dinovite. It's awesome stuff. 90 days of Dinovite will make your dog a happy dog. It will help them with their overall health. You don't need to spend thousands on vet bills. Dinovite is the best thing that's ever happened to my dogs, besides me, of course. Call 859-428-1000.
859-428-1000.
DINOVITE.com.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
So Dr. Van Nuys, thank you very much. Right before the break, you were saying that, the gold standard is definitely brushing the teeth. Not always the easiest thing that's around. So especially for dogs, people will go to the pet store in particular, and they'll find these various chews. And they go, the dog loves it and it chews on it. And for years growing up as a kid, we always gave him bones to chew on. Tell the listeners a little bit about how dog teeth and cat teeth differ from people in chewing and why we need to be careful of some of these various chews, how to pick a good one. So lots of things for you to cover.
Yeah, the big problem with the chew toys is that dogs especially think that they have molars in the back of their mouth. They think they have flat, crushing, grinding teeth like a goat or a horse or like we do. And so we go down to the pet store and we go to the section that says, buy these, they're good for your pet's teeth, and we buy them hard cylindrical objects and like bones and nylon bones, bully sticks, antlers, and the dogs put them in the back of their mouth and they try to crush them. The trouble is that the teeth back there, if you get a chance to lift the lip and look way back there, the teeth are tall and thin from side to side and they're pointed and they don't even touch one another. They don't even meet with one another. They slide past one another like a giant pair of shears. And as you know, some veterinarians call those teeth the carnassial teeth, meaning meat shearing teeth. So the dogs will pick these hard cylindrical objects like an antler. That seems to be currently what's keeping us busy. They'll put it sideways in their mouth back there. They'll try to crush it with the flat grinding teeth that they don't have, and they'll break the points off of these shears, which is what they really have back there.
And then when they break it off, you look, it's like, okay, sometimes they seem to do it just right and get one of these slab fractures, and you get them under anesthesia, and you take a radiograph of the tooth, and it's going, okay, you did not compromise the root. What can you do? And you can do many more things that I can do in my own practice. So what are some of the ways that you treat those slab fractures, and when do you have to do more extensive things?
The slab fracture does seem to be the most common fracture that they get, and that's where the outer face of the tooth breaks away from the rest of the tooth structure way back there, usually on the upper tooth that's so big. If they just chip the enamel off a little bit, we can smooth that. It doesn't really seem to be pain and infection for the patient. If they just chip enough off to expose the underlying sensitive dentin, that's the porous part of the tooth structure that's sensitive to hot and cold and potentially could let bacteria leach into the inner portions of the tooth, we can smooth that and apply a sealant, a bonding system that will clog up those open little microscopic tubules so that they'll relieve the potential sensitivity to hot and cold and the potential for the bacteria to get on the inside of the tooth. You could put a crown on a tooth like that has been compromised. Unfortunately, you kind of have to grind a significant amount more off the tooth to make room to place a crown on top of it. So sometimes that's not a good option for that reason. And certainly if they have broken enough off of the tooth where they have exposed the bleeding pulp, that is painful. That is going to get bacteria on the inside of the tooth, and if it's left untreated, it will rot the rest of the tooth out from the inside. Those teeth can either be extracted to be just permanently done with the problem, or it can have a root canal procedure, often with a protective crown over it to keep the structure and the function of that tooth in the mouth.
That's a hard decision because there are times when I give a client those options and I can't do a root canal here. I will need to send you to a specialist, someone like Dr. Van Nuys, and they go, how much? So I know every portion of the United States is going to be a little bit different, but as an overall kind of guesstimate, how much would a root canal be and then a root canal and a crown?
Yeah, I always get in trouble when I speculate on prices because I'm usually wrong. By the time somebody brings us in a broken tooth, there's often 2 or 3 broken teeth. Can you do a cleaning on top of that? And so I'll give you my best idea about what would a medium-sized dog root canal be. It might be in the $1,000 neighborhood. Put a crown on there, it might be 2 or 3 times that amount. A little unpredictable, but it certainly in most places is going to cost more than an extraction. So you mentioned that you give your clients the option and discuss the pro and the con, and that's exactly what we do here too. There are some clients who just want to be over and done with that tooth and never think about it again, and for those people, extraction makes perfect sense. Really, most of our dogs seem to get by just fine without that tooth. There are other clients who would like to save that tooth for a variety of reasons, including they don't want to put their pet through the difficult extraction procedure, or they would like to keep the structure and the function in the mouth. And for those folks, root canal, with or without a crown, makes a lot more sense. So we're with you. We give them all those options too. We listen to what their desires and expectations are for the future.
And Dr. Van Nuys, you were just talking about extractions, and sometimes when you're in there, you initially think there's going to be one bad tooth, and as you're looking around going, oh, and that one has a problem, oh, that one has a problem. And as you're saying, dogs will have 42 teeth, cats 30, and there are times I've had to remove almost all the teeth from a pet's mouth, and these people are just aghast. It's like, oh my goodness, how can a pet eat after you've removed all these teeth? How many teeth do you have to have left in a pet's mouth for it to still have a good quality of life?
We just took 37 out the other day. I think that was the most that we've done anytime recently. And the answer is they don't need any teeth to eat their food. And how do they eat without all those rotten teeth? They eat better. The pain is gone. The infection is gone. Think of how these pets were eating before, and they were eating before with 37 teeth in there that were loose, and every time they bite down on their food, the tooth moves a little bit, and it's sitting in an infected socket, and it's just awful. I don't know how they were eating before the 37 extractions, but they certainly eat fine afterwards. They gobble their food. Their stomach does most of the digesting. I would say that's the most common reason that somebody sends us a nice card that says thank you is, boy, I wish I'd have done that 5 years ago, and here's my phone number in case somebody else wants to talk to me.
I've heard that too, and there are times it's literally, quote unquote, pulling teeth to get that client to agree to have the pet's teeth cleaned because it's an older pet. Oh my goodness, it doesn't seem to be having a problem. Yes, right after the procedure, they're uncomfortable. We have them on pain medication. We try to do the best, but yes, they're going to have a little bit of a lag time before they're back on their paws again. And when I see them back in that week's time usually for a recheck, they go, oh my goodness, I had no idea this pet was feeling so poorly because now it's playing like a puppy, it's playing with a toy it hadn't done before, that cat is running around, it's purring, it wants to be with me. It's like, I wish I had done this before.
I agree. We like to get them back in 2 weeks for a recheck just to look in the mouth and make sure everything's healing well, and if there are stitches in there, that's going fine. And the dog didn't open a socket up and stuff it full of grass and hair like dogs will do sometimes. But what's so rewarding about that 2-week recheck, so many people tell us, I never noticed that my dog had a problem, but now I notice that he's better. It's a rewarding part of your day.
Awesome. Again, we've been talking about dogs so much, and then there's cats, and cats are such unique little creatures, and I'd love to have you kind of tell the listeners about feline oral resorptive lesions, a cat's own kind of cavity. What causes it? What can you do about it?
Yeah, a lot of questions, not a lot of answers on that one, Dr. Cruz, unfortunately. It looks like a cavity. We used to call these things cat cavities, and I remember in the 1970s there was a company that came around to all us veterinarians and sold us little kits so that we could drill them and fill them.
I tried that, yeah.
Didn't you? A lot of us did. And
it didn't seem to work real well.
6 months later, your cavity filling would still be in there looking all pretty, but the destruction of the tooth would have continued. And then somebody smarter than I figured out that they're not cavities, and that's why treating them like cavities didn't work. It's a tooth resorption is a bone remodeling process. You think back when your baby teeth came out, what happened there was that the bone reclaimed the roots of the teeth. You didn't have an infection. You didn't break your tooth, but it got loose, and then you pulled the baby tooth out, and there was no root on it. It had kind of a concave surface on it, and you just got the crown. So that's bone remodeling, tooth resorption, as it should be. So nobody understands why cats are resorbing their perfectly good adult teeth. And the other part of the mystery is we think this is a modern phenomenon. We think it was fairly uncommon prior to the 1970s, and now 2/3 of the cats at random, if you just walk around the neighborhood or around the world, 2/3 of the cats, if you x-ray all their teeth, they've got at least one in their mouth. In average, they've got 3, and that's astonishing. So there have been many theories about what causes that. Nobody's come up with anything that has stuck. So unfortunately, we don't have any treatment for that. And we just end up extracting those teeth because we do believe that they are painful, and they do appear to allow bacteria access to the teeth and the gums, and sometimes they'll lead to nasty infections.
So I know too often it seems like I've seen it, this year I find one, and then in another year or two there's another one, and it just seems to keep popping up. So hopefully the smart veterinarian researchers out there will come up with a cause and a treatment so we don't have to extract these teeth.
I hope so, because all they're doing right now is publishing papers about how they don't understand what's going on.
Well, I'm glad you don't understand. Now figure out the answer, please, quickly for us. Another real area of controversy and concern is you have that older pet talking about putting it under anesthesia, and clients are so nervous about general anesthesia with their pets. They go, but I can take my pet, depending where they live in the United States, to my groomer, or there's a mobile service that does it and does a non-anesthetic dentistry. What's your views of non-anesthetic dentistry? Are there ever good reason to do it?
Yeah, it's limited, and I think some people don't understand that it's a limited service that is different than what you can accomplish under anesthesia. Under anesthesia, you can find the hidden disease, and you can clean the hidden disease or treat the hidden disease. Without anesthesia, you're just limited as to how much you can discover, how much hidden disease you can discover, and how much hidden disease you can treat. So my thought on that is that it can have a place, but it has to be more of the maintenance. It can't be treating established hidden disease. That's all. So perhaps somebody would have the pet under anesthesia for probing around and looking for pockets with a little measuring probe and taking x-rays of the teeth and finding and treating any hidden disease. And then after recovery and healing, maybe the non-anesthetic folks who can help remove the plaque and the tartar and be part of your ongoing maintenance program. Maybe that makes the most sense.
And I think so many people need to realize that just because your pet is mature doesn't mean you can't put them under anesthesia. Anesthesia has become so much safer with certain safeguards of doing preoperative blood work and doing EKGs and the way they can be monitored. We oftentimes do really ancient dogs and cats, get them safely under anesthesia, do what we need to do, wake them up, and they've done just fine.
I completely agree with that. Rather than avoiding anesthesia, veterinarians have just become better at anesthesia. We have good monitoring equipment. We have dedicated people who are well-trained, who are paying attention. Paying attention is everything with anesthetic safety. I agree with you. I think it's getting better and better, and certainly every practice I know now is anesthetizing teenage patients without a problem.
I love it. In the few minutes that we have left, I would love to have you tell the listeners about some of those really exciting things that veterinary dentistry is now able to do. So what are some of the really fancy things that you're doing there at your practice?
Well, we're talking about fancy things, and such as, lengthening the lower jaw if it's too short. Certainly you can do dental implants the same as people. There are periodontal surgeries where you can peel the gums open, scrape out all the infection, put in bone graft, put a barrier in there, and actually regenerate bone. We mentioned how difficult that is, but it is becoming possible. Unfortunately, we're quite limited in pets because many of these procedures in humans are multiple procedures, and of course in our patients, now they're multiple anesthetic procedures, and our clients are already kind of freaked out about having one anesthesia, and now we're talking about a procedure that's going to be multiple anesthesias. So in some cases, the other objection that we're having to these advanced procedures, including the dental implants, which have become so standard in people, is that it may not be ethical to do that to our patients. We talked about how our patients do so well without their teeth, and they do. They're fine. The infection and the pain are gone. They still eat fine. So if we put the patient through the time and the expense and the trauma of multiple anesthetics and, invasive bony procedures to keep a tooth or a false tooth or many false teeth in their mouth, I see the cost to the patient. I'm not sure I see the benefit to the patient. And at that point, as veterinarians with licenses, we kind of have to step in and say, am I doing this for my patient's benefit? Is that ethical? Or am I doing it to make myself feel clever? That's a discussion that we have all the time ongoing, and I think it's a good, healthy discussion.
I love that attitude. So just because you can do it doesn't mean you should do it. Dr. Van Nuys, thank you so much. I know that's why I am so happy to have you close by to my practice. So when I run into these cases that needs that expertise, I can send them to you. So this is Dr. Bernadine Cruz on The Pet Doctor. We've been chatting with Dr. Eric Van Nuys, again, a board-certified veterinary dentist in Tustin, California. Dr. Van Nuys, thank you again so much for being with us today.
Thank you, Dr. Cruz. It's always nice to see you and nice to talk with you.
All right, so please tune in again next week. We'll give you more information on how to make you the best possible pet owner. Thanks for listening. Take care.
Pets can be a wonderful addition to your life because they're a member of the family. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.